Okay, Commissioners, I have 3 o'clock, so therefore I'm going to call this meeting of the Health and Human Services Committee to order. The first order of business is a roll call, so if the clerk will please call the roll.
All right, we'll start with Commissioner Duje.
Yes, still in hell, Livingston County, Michigan.
Commissioner Sauger. Commissioner Kleinfeld.
Veronica L. Kleinfeld, East Point, Macomb County, Michigan.
Commissioner Romano.
Commissioner Romano, Sterling Heights, Macomb County, Michigan.
Commissioner Myjack. Commissioner Myjack. Commissioner Carabelli.
Present, James L. Carabelli, Shelby Township, Macomb County, Michigan.
Commissioner Brown. Commissioner Brown.
Don Brown, Washington Township, Macomb County, Michigan.
Commissioner Kraft.
Philip J. Kraft, Chesterfield Township, Macomb County, Michigan, is present.
Commissioner Lucido. Commissioner Leonetti.
Robert Anthony Leonetti, present, Harrison Township, Michigan, Macomb County.
Commissioner Haw.
Harold L. Haw, present, Roseville, Macomb County, Michigan.
Commissioner Smith.
Commissioner Smith, attending remotely, Clinton Township, Macomb County, Michigan.
Commissioner Drollet.
Commissioner Leon Noel Drollet, participating from Macomb Township in Macomb County, Michigan.
And that completes the roll.
Thank you. Our next item is the Pledge of Allegiance. So if all would please rise and face the flag and restate the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, the next item on the agenda is the adoption of the agenda. Is there a motion to
adopt the agenda?
Support Carabelli.
Very good. We've got a motion and support from Commissioners Romano and Carabelli. Please vote.
That motion passes 11-0.
Thank you. The next item on the agenda is the approval of minutes dated October 20th, 2020. Is there a motion to approve?
So move, Haw.
Support Carabelli.
We have a motion by Commissioner Haas, supported by Commissioner Carabelli. Please vote.
That motion passes 11-0.
Thank you very much. Next item is public participation. Any member of the public that would like to speak on an agenda item, this is your time to speak. You have 5 minutes to speak on any item on the agenda. There'll be a second public participation period toward the end of the meeting, which you can speak on any item.
What happens is, if you trigger on too many of those, it turns red and says you may not enter the building. So we focus very, very strongly on source control. At this point, I'm sure my HR is going, why did Kevin do a second one today? But I wanted to show you just how quickly the results come back as we answer that. The nice thing about this is there is a log on it as well. So you can see your history. If a survey or the health department needs to say, okay, how many times have you done this? We can show that we've been really consistent in this. So it's a nice little program that every one of our staff is required to use every day. And in this case, our focus on source control caused me to stay home until I get a either a symptomatic strategy where I'm without symptom for a number of days, or my tests come back negative. So enough about me. Just want to talk about how important it is for you to know that we really focus diligently on source control. We currently have 3 of our staff members positive on COVID, and 2 of those we had before they even came in the door. We have 1 resident that is tested positive, and that was a new admit that came directly into our isolation area. I'm proud to say that there are no clusters in our building or no vectors that came from our building or into our building. These are all isolated incidents. Our team is doing an excellent job on that. Most facilities are using surgical masks as their standard in the facility. We're actually using KN95s throughout the building, and that's in large part due to the work with the county. You've provided enough so that we can use a conventional strategy for those. Our staff get a new one every day, and I believe it's done a great job in keeping us safe. Our census is actually on the upside, starting to improve. We were down to a low of 164, which was more than 40 below what our average was prior to COVID-19. We're up at 185 right now, which puts us a little over 85% capacity, which is still far better than the state is. But I'm pleased to say that we have kept our procedures in place, including our isolation area, so that we're able to admit safely anybody that comes in from the hospital or anyone that comes in from their home. Our finances are remaining stable right now. We did not expect it to last this long, and as I'm sure Steve Schmiegel has shared with you, testing weekly is incredibly expensive. It's about to get more expensive because the federal requirement for our facility is that we test twice weekly if the county goes above 10% positivity rate. And so far this month, according to the website, we're at 14%. So we will need to be testing all of our staff twice a week. This creates a lot of stress to our staff, but they're still coming to work, although they are pretty tired of getting their nose poked every week, and now it's going to be twice. So I just wanted to share about the security and safety that we have, Premier, and that we are headed in the right direction on Census. If anybody else has anything they wanted to share or ask, I'm at your leisure.
Kevin, thank you much for that report. We do have a commissioners with questions. Commissioner Kleinfeld.
Thank you. My first question is with regard to the 10% positivity rate. Is that 10% total over all this time, or 10% at a given moment?
It's a weekly calculation that the CDC does. We're required to weekly send our information as it relates to our facility. The counties also send information into the National Health Safety Network, and that information is calculated and then shared through the state of Michigan back to us through the Health and Human Services.
But if we had a current positivity rate in the county of 14%, I mean, we'd have over 80,000 today. So it sounds like they're using a collective statistic of everybody who's ever tested positive.
No, that's a good question, and that's one of the challenges that we have with data like this and with thresholds. These are tests that are done, so it's a positivity rate of those tested.
Of those tested.
It's not of the entire county. So, for example,
I got it. You don't have to. I completely understand what you're saying now. It just totally changes the picture.
Yeah.
I just have 2 more quick questions. The first is, with everything that's going on, how is your turnover rate with employees, and how's morale?
Our turnover rate is starting to show a little bit, especially in the non-clinical areas. They can get as much money and sometimes more from unemployment. And I will tell you that our staff is really working hard, but there's a lot of overtime being done to make up for those that had just said, well, I'm gonna go home and just take unemployment for a bit. Morale is mixed. We have some that are just fierce warriors that they know that they need to be there. We've had we've had loved ones pass away, and they attend their funerals and they come back. They've died of COVID. They've died of heart attacks. They've died of stroke. They've gotten sick themselves and they've come back. So it is a mixed bag, Commissioner, but it is, I would say in talking with other facilities, we don't have the morale problem that most have, but I certainly do see that our folks are just tired. So we're doing what we can for them right now. We're bringing some weekend meals for them, which they absolutely appreciate. That's where our weakest area is at. We're going to be having a hero party for them next month, where we'll be giving out some prizes. And again, it's socially distanced. We have that outstanding celebration center that we're not allowed to have anybody come in right now. But we can have, a unit of employees at a time come down, enjoy some time to get some drawings for some prizes as a way of saying thank you for them. So, but we're doing some things to help them. We also have, incentives for them to come on off shifts and off weekends to kind of help with that. But I will tell you, the money is not the issue anymore. It's just simply the fatigue.
Okay, thank you for the update.
Thank you.
Thank you, Commissioner. Commissioner Carabelli.
Thank you, Mr. Chairman. Kevin, a question I have is, did you mention that the cost for all these COVID tests is going high? Is that what you were saying?
Well, the costs are the same, but the number of tests that we have to take, when we're doubling the number of tests per week. So we actually got a less expensive test, which is a rapid screening tool that is significantly less expensive than the PCR tests. The PCR tests take a couple of days to produce results, and they are $100 each. That number is set by the federal government, so there's no price gouging allowed on that, but it still is $100 a pop. And when we have any positive staff member, anyone, it doesn't matter what the reason, it doesn't matter if they came in the building or not, we have to test all of our residents. So we're currently testing roughly 500 people a week.
Okay, Kevin, I get that. I'm trying to understand here. Are you using your CARES Act dollars, or did you already run through your CARES Act dollars for that?
We've already run through the CARES Act dollars, and we've been talking with Steve and Vicki about getting some more money from, for that for the rest of the year, because nobody expected it to go this long. And they're struggling to find some help for us on that. But they said they recognize that we're the first line of defense for this. So I know they are working diligently to find ways for us to make sure that we're continually funded on that. We still have hero pay that we're required to pay out. We're not allowed to go to the state for that because the CARES Act money came to the county. So when they extended it at the state level, we're still required to do it. But as it's called a third-party participant in the grant process. So we are a third-party participant of the county itself. So that money does have to come from that $155 million.
All right. Well, you kind of lost me there after a while. So
I'm sorry.
Let's shorten this up a little bit.
All right.
The county's doing drive-through testing and providing this for the residents, and any commissioner can interrupt me at any time that this is done for free. So my question is, if these are residents of the county, being that we have Martha T. Berry, would that not consist of using the county program?
Well, it is the CARES Act money that we're using specifically for this, Commissioner. So
I thought hold on. This is where I'm getting confused. I thought you said you went through your CARES Act money and you're out, and that's why it's so expensive.
Well, no, I understand that. I apologize for the for this. Let me clarify. We received some CARES Act money directly from the federal government, and we received an allocation from the county from the CARES Act money that came directly from you. The money that we have already that we received, we have already run through that came directly from the feds. Okay, so I know it's incredibly frustrating because There's so many different ways the money came from, but essentially it came from two sources. Federal money sent it directly to us, and we are issuing invoices to the emergency operations, and they're paying it out of an original $3 million allocated for us.
So then you're not out of money, and that money's being used for these tests from the county?
So we have spent more than the $3 million. We're actually over $4 million right now on that, and we're looking to maybe get another 1.5 to 2 to get us through to when the vaccine comes.
Okay, I'll ask more questions offline. Thank you.
Okay, I see no other speakers, but Kevin, just piggyback on Commissioner Calabara's question. I guess my question would come down to this. Do you have the resources you need to do the testing that you need to do?
Yes, we do right now. Thank you. We're projecting that that we are going to be continually needing more money than we have allocated to us, and we are doing the best that we can with that. But we're not going under by any means. No, the county has been outstanding in helping us with that. The CARES Act money that came directly to us helped us really get started on it, and then when the CARES Act money from the county came through, that's been incredibly helpful. We are hoping for another direct allocation from the federal government this month, which should help us as well. So, no, we are, we are on task. You know, when we dropped our census and things, we dropped what we could in terms of expenses. We've been managing really, really well, even with the additional COVID expenses. But again, we couldn't have done that without a collaboration with the county.
Okay, and have the indications you've received from the county been that the resources will be there from the CARES Act funding to continue to do the testing that you need, or have you gotten any signs that we may need to, there may be a question of that resources being available? Are you confident those resources are available to the county?
Yeah, I am confident. Both Steve and Vicki said that yeah, we understand, as fluid as this is, they want to make sure that the seniors are taken care of. So I don't have a specific dollar amount on that because I don't have a program end and beginning like some of the other programs that I see on the agenda have. What I do have is, unfortunately, the need to continue doing this for I don't know how long. So, and it's hard to put an allocated budget for, but I do know that they've been incredibly helpful with us. They've been encouraging us to continue submitting invoices, and there's been no delay when we have those invoices that the CARES Act money comes directly back.
Okay, thank you. Commissioner Leonetti has a question.
Thank you, Mr. Chair. Kevin, good to see you. Listen, last year the board approved, a small property tax to help you with some of the, financial situations over there. And then who knew? Who knew you'd be hit with this COVID stuff, right? So I guess my question to you is, there was a 1-year deal. Were you able, despite all this COVID stuff, to use those funds to put yourself in a better position?
Well, Commissioner Leonetti, we actually haven't received any money from that yet.
Okay.
As we were told by the Treasurer's Office, we would not be able to allocate that until the winter taxes. So that's going to start coming in, I believe, in the next month or two. So,
okay. So I guess my question is, again, in light, nobody knew what was going to happen in 2020. That money was supposed to be used to help you with the, financial situation that was going on over there. I hope that money's not going to be expected to be used to do this testing. Do you know what I'm saying? I want to make sure that what we had the taxpayers help you on was to keep you viable and keep you open, given those circumstances. And we know how you got to that position. It was, the lease and a few other things. So I guess I won't know. I'll hear about it in the papers, but I hope that you're able to, in your budget, use that money to take care of what you had to before COVID as much as you can. And I hope you get money from these sources, the federal government and the state and maybe even the county, so that you can apply that money while you're doing all this testing for what it was originally intended for.
Thank you, Commissioner Leonetti. I appreciate that. As a matter of fact, Steve Schmiegel and I have had conversations to that very end to make sure that that we get the money that's needed for the purposes of ongoing sustainability at Martha T. Berry. So yeah, we fully intend on that money going towards the building as it needed and the expenses of finishing up on some of that debt service.
Okay. All right. Thanks, Kevin. Good to see you. Thank you, Mr. Chair.
Thank you.
Thank you, Commissioner. I see no other commissioners wishing to speak. With that, Kevin, thank you for the report, and especially thank you. We know that this deadly virus has particularly affected, nursing home facilities. So you're on the front lines. You're doing a heroic job, and you have our full support. If there's anything we can do, let the commission know, please. Thank you for the great work you're doing.
I'm grateful. Thank you, Mr. Chair.
Thank you. Okay, commissioners, please vote. Mike, I assume that was received and filed.
That motion passes 11-0.
Okay, thank you. Our next item is agenda item 7, department recommendations. The first of which is number A, COVID budget amendment, Health Department grant fund, influenza vaccination supplements. I hope we have someone from the Health Department here, perhaps Bill Rodella.
Yes, good afternoon, Chair Drolet, and good afternoon, Commissioners. I'm on the call.
Thank you so much. First, I'll need a motion in a second to approve and send to full board. Are there a motion to approve?
Move, Carabelli.
Motion by support by Carabelli. Okay, Bill, please tell us about this particular supplement.
Good afternoon again. The state of Michigan Department of Health and Human Services is supporting a grant to the Health Department of $263,004. So this money is to be used for either flu and or the COVID-19 vaccination effort. So these are dollars that we need to receive this fiscal year, being the health fiscal grant year 2021, dollars to be spent by the end of June 30th of 2021. So we are asking that our health fiscal year grant fund is increased by the $263,004, which will go towards grant revenues and also increase expenditures by the same amount. So we can use the funding to support any of our personnel costs, any of the equipment we need, whether it's for storage units of refrigeration, syringes for providing vaccinations, any of the staff that we're going to need, especially when we come to the COVID-19 vaccination, where we're going to need additional nursing staff to administer vaccines. So it's a small amount to supplement what we will expect to get more money from the state. So we're still waiting for additional dollars to come in also. So with that, that's a brief update of that grant.
Terrific. Are there any commissioners wishing to speak or have questions? Okay. Seeing none, we have a motion and a second. Please vote. And Bill, we hope that we can use this funds on a vaccine for COVID sooner rather than later. So thank you.
We're getting prepared.
That motion passes 11-0.
Thank you very much. Next, we have a series of items all pertaining to the Community Action Program. I believe they all pertain to that. I can entertain, well, let's go through them because some of them are COVID-related and some may not be COVID-related. So the first item is
approved 7B.
motion for B from Duje. Do we have a second?
Support from Kraft.
Support by Kraft. Okay, do we have Mr. Covey here from the department?
Yes, I am on the line. If we have Joe Cook on the line as well, he can speak best to this first item for MCA today.
Okay, great. Please proceed. You have to hit *6 to unmute.
Sorry, thank you, Mr. Chair. Joe Cook, Community Action Division Director. You have before you an amendment to our 2019 Annual Action Plan to program the Community Development Block Grant, CV3, and the Emergency Solution Grant, CV2 funds. The amendment acts to the action plan acts as the county's application for these funds. The CDBG CV3 allocation in the amount of $1,530,725 will be used to assist low to moderate income persons who reside in the jurisdiction of Dearborn County, while the ESG CV2 dollars in the amount of $801,422 will be used to assist homeless persons throughout Macomb County.
Okay, we do have some questions. Commissioner Kleinfeld.
Thank you. The first question is, are there places in Macomb County that are not in the Urban County CDBG program?
Correct. There are 5 entitlement communities that receive their CDBG dollars directly from HUD.
Okay. Then the other question is, the substantial amendment, what we got was 3 pages long. Is that the actual amendment, or was that just a summary of the amendment?
We're asking for the approval of the amendment. The amendment to the annual action plan will act as the county's application to receive those funds.
Yes, my question isn't whether we're approving the amendment, it's whether we actually got the amendment or a summary of the amendment. Is the 3 pages we got the amendment in its entirety?
I'm going to ask Stephanie Burgess, who is our program manager. I'll mute myself so she can unmute herself, and she can answer some of those specific questions.
Hello, this is Stephanie Burgess. Yes, that's a summary of the amendment.
Okay, how many pages is the actual amendment?
Well, it's the entire plan, which includes the consolidated plan, so I think it's going to be around 400 because it also includes the consolidated plan includes all the consortium members, which would be Sterling Heights, Clinton Township, and Roseville. So it's a very large document.
So if you just looked at the changes made to it, how many pages do you think the changes made to it would be?
They're different screens. So I would say the screens that are affected is going to be about 5 pages, maybe 5-6 pages, because it's how it's set up. It's the federal system, and there are different tables that you add information to, but I believe it was 5 screens total that they had us amend. But we weren't amending the entire consolidated plan, and this information, quite honestly, if you look at that, would have been buried in it and very hard to read if we would send you the whole IDIS consolidated plan, amended. So that's why we provided it as a summary.
All right, thank you.
You're welcome.
Okay, I do not see other commissioners wishing to speak on this item. So thank you. Let's please vote.
That motion passes 11-0.
Thank you very much. Next, we have item C, purchase signature Ford Transit vehicle for $28,329. Is there a motion?
Motion to approve, Hall.
Support from
Brown.
Okay, we have a motion from Ha, support by Commissioner Brown. I believe this is Mr. Covey as well, right?
Yeah, happy to speak to the rest of the MCA items. This one is for purchase through our LIHEAP program. the home energy assistance program that we do our weatherization services for. We're just acquiring an extra transit vehicle to help upgrade our fleet and help support our home renovation and weatherization programs.
Okay, that's pretty straightforward. Are there any commissioners with questions on this item? I see none. So we have a motion support. Please vote.
That motion passes 11-0.
Okay, thank you very much. You could take a motion perhaps on, I believe D and E are related to each other. If there's a motion for items D and E, we could hear the get the explanation from Mr. Covey and potentially vote on both.
So
Is there a motion?
Chairman. So moved, Mr. Chairman, by Brown.
Okay, we've got a motion from Duje, support by Commissioner Brown. Mr. Covey, go ahead and tell us about items D and E.
Yeah, this is another opportunity for Macomb Community Action to be part of a state effort called the Digital Divide. These funds are still being identified by the state, and I believe the total will be around $300,000. I think there might have been a typo in item E as well. We originally received purchase D for the 250 iPads and data plans, and we just received information from the state of Michigan that several regions found they were unable to participate in the Digital Divide program, so they were calling with a notice of additional funding availability, which we're still finalizing. But the purpose of this program is to help out families with digital access. During the coronavirus crisis, we've seen that lack of home internet access or lack of computer access has really burdened families disproportionately. Poorer families, families with multiple children, single householder families. Despite the school districts providing one device per household, we know that it's created a burden upon those households that do not have internet access. Every region in the state was offered the opportunity to participate in the Digital Divide program. Because of the tremendous capacity at Macomb Community Action, we were more prepared than others to execute on this. And what we chose to do was to provide an iPad, which we thought was a premium device, to include a year of digital service for that, so they have a data plan, and also to provide an accident protection plan for it as well. So if they have accidents, spills, breaks, whatever it may be, this device not only has the accident plan, but also has the data plan. It's not a great number of devices. As you can see, it was initially 250. We believe with the increase, we're going to be able to get up to 300 devices. Clearly a very small amount compared to the overall county need. Nonetheless, it really is a tremendous opportunity for us to support some vulnerable households, especially in this virtual age we're living in. I think it's going to really help a lot of families in Macomb County to have this new device with the data plan, with the accident plan already on it. And we'll be distributing those next month.
Okay, thank you. We do have commissioners with questions. First, do we have Commissioner Kleinfeld?
Thank you. Originally, when I looked at this, I thought, wow, for the cost of it, we're only able to help 250 to 300, and I was wondering, is it better off offering the digital plans? I mean, most people have cell phones, maybe offering the digital plans for people's cell phones that they can no longer afford, and we might be able to offer more while not purchasing the iPads. But I understand the school situation. So now I'm curious, how do you determine who's going to get these? Are you going through the schools?
It's a great question, Commissioner, and it's one that we wrestle with. We obviously want these to go to families that are the most in need. So what we've done is we're working through our community action centers. Our centers all year long during the coronavirus crisis have been responding to urgent needs of our households across Macomb County, and we already have a list of families that we've supported, whether it's with eviction diversion or utility payments, some home rehab, or our food program. We're going to go back and look at the list of families we've already interacted with that we know are in need, that we have documented eligibility for, and that can help expedite the distribution process because we've already worked with those families this year, and we know.
But they may have iPads, and you may have kids sitting that are supposed to be attending virtual classes that don't have iPads in the schools. So I take a look at that. The schools may know of kids that this is an issue with.
We do work with the school district homeless liaisons. We have regular contact both with the homeless liaisons and the Child Protective Services offices, and we work closely with the Superintendent's Council of the school districts as well.
My question is, are these theirs permanently then?
Yes.
All right, thank you.
Thank you, Commissioner. Next, we have Commissioner Haw.
Thank you, Chair. Ernest, thank you, and I support the program. Commissioner Kleinfeld asked all 3 questions I was going to ask, so thank you for that. That's all I have, Chair.
Thank you, Commissioner Haw. I just have one question. In providing the internet connectivity using these CARES Act dollars, how long will we provide internet service for? 2 years, 3 years? Do we cut them off after CARES Act funding stops?
We were advocating that we could include a year data plan, and we were successful in that advocacy. Obviously, our concern was these are CARES Act dollars controlled by the state of Michigan, and we weren't sure it was going to be feasible in the first place to provide a whole year of internet data subscription. But the state cleared it with their auditors, and they gave us the go-ahead to purchase both the protection plan, which will be ongoing, and a 1-year data plan. So that was the leverage that we were able to secure through the state of Michigan, was a 1-year data plan and the accident protection plan for these devices.
And they're going to go to 300 people out of 800,000 people.
Yeah, it's like I said, it's a hard situation. What I can tell you is the reason we just got this extra increase is because counties around Michigan found that they were unable to participate. Most community action agencies this year, as Macomb Community Action has been, have been overwhelmed by the number of demand, by the new services, by the duplication of services being offered by the state of Michigan, and by a lot of federal alterations to our contract, such as Mr. Cook presented before. Those coronavirus funds on top of our existing CDBG were unexpected. And we have several programs like that. And so we're just trying to do the best that we can. And it's really hard to know that we can't help more when there's more need. But we're optimistic that we've done what we can to secure dollars from Macomb. And we've done so in such a way that we've secured even more dollars from Macomb County residents.
Okay, we have a question from Commissioner Myjack. Commissioner Myjack? Commissioner Myjack.
Yeah, I wanted to speak on new business. I'm sorry, I accidentally pressed it.
Okay.
Pass.
Well, then we have no other speakers then for this agenda item. We do have a motion and support. So please vote.
Chair?
Yes.
Chair? I'm sorry, just real quick. I'm sorry, I thought I put in for it, but how is it that we've asked, and this is what I'm missing with this, we've asked our IT department about plans that go on beyond the end of this year for CARES Act, and we can never do anything more than this year, but when, but on this particular one, we can do a year plan after the end of the year. I'm just wondering, is that opening up a little bit? Do we know? And maybe we should look back at some of the things we've done with our IT department and try to get a little more mileage out of the CARES Act dollars with continuing costs that go on beyond the end of the year.
It really is unclear. What I can say is there's a different determination here because this is coming from the state of Michigan. The county is working with its auditors and its financial team to make sure we have the most conservative interpretation of the risk that we're for here going forward with the CARES. So the county is working to make sure. Go ahead.
Well, I'm happy that this is that you're able to do that. My question more is maybe we should talk to our finance and our IT department and see if there's anything more that can be done to utilize, maybe this type of program where they continue on past the end of the year, because we always say we can't do it more than the end of the year with, maintenance programs and different things like that on these IT issues. So maybe we might want to look into that a little bit. And it's not for you. I'm happy that you guys that you brought this to our attention. That maybe it's a possibility we could actually go on beyond the end of the year with some of this money.
Yeah,
the question is probably best asked to our CARES Act coordinators for the county and the executive commissioner. So we'll
I'll bring
file that away,
Commissioner, just for that purpose, not to ask Ernest to check into it for us, but maybe we might want to look into raising that question there. I'm going to put Crystal on that, maybe.
All right.
Thank you.
Okay. Any other commissioners that I missed? Okay. Please vote then.
That motion passes 11-0.
Thank you very much. The next item on the agenda is carrying forward CARES Act funding from one budget year to the next, item number F. Is there a motion? For item number F, carrying forward CARES Act funding?
I'll make the motion, Myjack, Mr. Chairman.
Thank you, Commissioner Myjack. Is there a second?
Second.
Okay, that sounds like Commissioner Brown. Yes. Okay, so we've got a motion and seconded. I think this is still Mr. Covey, carrying forward CARES Act funding into, it sounds like an accounting situation. We're moving it from one technical budget year to another technical budget year. Is that correct?
That's exactly right. This is a range of funding passed through, not through the county, but through the state of Michigan for CARES Act, covering a range of assistance, mostly including water and wastewater assistance, as well as water and plumbing repairs, and some other programs. We just need to do it fiscally to make sure we transfer it to the current fiscal year. We still expect to spend all of this down by its due date of December 31st, 2020.
Okay, thank you. Are there any speakers or questions? I see none, so please vote. Okay, and final item under our agenda, item number 7, is a COVID budget amendment, Macomb Community Action Head Start, Head Start award from MDHHS for COVID response of $820,806. Do we have a motion? We have a motion from Commissioner Duge. Is there a second?
Support, Kleinfeld.
Support by Commissioner Kleinfeld. Mr. Covey, could you please tell us a little bit about this?
Yeah, these are dollars specifically to help our Head Start program respond to the health concerns around COVID. This came from the Office of Head Start through the DHHS federally. All of the Head Start agencies across the country have been receiving a range of support to adapt their programs related to COVID. We are using this to help provide more hygiene and more sanitation within our classrooms and within our home center locations. Things like UV air filtration or surface disinfectants, just to make sure we're taking the utmost standards of caution with the health and safety of our students, families, and staff.
Okay. Are there any commissioners with questions on this agenda item? I am not seeing any. So seeing none, we'll vote then on the agenda item G, 7G. Okay.
That motion passes 11-0.
Very good. We'll move on to agenda item number 8 of the agenda, correspondence. I'll entertain a motion to receive and file, or do we want to separate these? With correspondence, we're receiving correspondence from the city of Sterling Heights. I'm sorry, I thought there was a resolution being put forward by a member of our board. No, it's receiving correspondence. So I'll entertain a motion to receive and file preferably A and B.
So move. Hall.
Or Dujay.
Moved by Commissioner Hall, supported by Commissioner Dujay. Hearing no questions, please vote.
Commissioner Drulette, this is Commissioner Romano.
Yes, Commissioner.
If I may, we jumped on that pretty quick, but I wanted to speak on item B of the correspondence.
Okay, please go ahead.
Sterling Heights passed a resolution asking that the area agency on aging 1B to terminate, which is terminating funding to the church program be reconsidered. And I would like to see that be reconsidered. I'd like to see that be brought back to the commission so we can discuss it further to see if possibly in this new budget we can find that type of money to help these seniors out. Or if not all of it, maybe partial, so that we can help the city of Sterling Heights and maybe fund part of this program. That's all I have. Thank you, Commissioner.
Thank you, Commissioner. I know we had some conversation at a previous meeting about this subject in which it was explained to us that, at least in the opinion of the department, that the way the funds were previously appropriated was not allowed under the federal or state guidelines. But we could certainly look toward putting it back on the agenda for additional questions. The next item on the agenda is new business. Commissioners have 5 minutes to speak on any non-agenda item the commissioners want to speak about, but you'll be cut off after 5 minutes. Are there any commissioners wishing to speak on a new business?
No.
Chair, this is Commissioner Hall. I press the button.
Commissioner Hall, you have 5 minutes to speak on any agenda or non-agenda item.
Thanks for the
You
5.
don't have to state your address.
Thanks for the 5, but I don't need it. I just want to point out we heard a presentation from Kevin at Martha Teaberry that they're looking at almost doubling their costs because of the mandate on testing. I just want us to keep that in mind as we keep spending millions of dollars of the CARE Act money, that is a definite need, and we don't want him running over budget and then having to come back and readjusting it for next year when the opportunity is there to use CARES Act money to support the testing that's being mandated by the state. So that's all I have. Thank you, Chair.
Thank you, Commissioner. I share that concern. That's why I asked Kevin a couple of times, do you have the support you need? Do you anticipate having the support you need? I hate to say us allocate CARES Act funding for something less essential than what they need it for at Martha T. Berry.
I agree with that 100%.
Okay. Any other commissioners under new business?
Commissioner Hijack is next. You do have a list.
I do. Oh, I guess I should push. Why am I not seeing this list? All right, Commissioner Hijack.
Yes, thank you. Yes, thank you. Sorry about that, Commissioners. Can you hear me?
I can hear you now.
All right, great. Yeah, I apologize for that. For some reason, this whole meeting, my phone, my mobile phone is just going crazy where it's in and out. So I thought I'd dial in with the hard line there, I guess. But I just wanted to see, is Bill Rodella here by chance, or someone from the health department?
He was here earlier. I'm not sure he's still with us.
Okay. Well, the one thing, Mr. Chair, that I just want to talk about, and this is actually, I think, damn good news, and I think I'm speaking for everybody, is the Pfizer announced that they have a COVID-19 vaccine that is 90% effective. So hopefully that's a step in the right direction. And I wanted to try and ask Mr. Rodella what type of plan we would have countywide. Obviously, this would happen when I'm not here next year, but if we're able to get the vaccine,
what the health department is doing to make sure the population of Macomb County gets that. So I guess that would be maybe my question, and maybe I'll just ask Mr. Rodella the next meeting that he attends, but that's all I just want to mention to everybody, that to see what the plan is for the health department and try to get everybody vaccinated, I guess. So, but it is good news today. So thank you, Chairman.
Thank you, Commissioner. It was hopeful. Because I'm unable to see a list in front of me, are there other commissioners that would like to speak on a new business?
Oh, I'm the last one, Leon.
Go ahead, Commissioner.
Just very quickly, because I'll save most of my comments for December. For the incoming and outgoing commissioners, I just wanted to congratulate everybody on hard fought races and on how everybody handled themselves. That's all I have. Thank you.
Thank you, Commissioner Kleinfeld. Okay, hearing no other new business, we'll move on to public participation. Any members of the public wishing to participate can hit *6 to unmute themselves and are free to speak on any item or non-item to the board. You have 5 minutes to speak. So hit *6 or raise your hand within the Zoom meeting and you'll be recognized. Any members of the public wishing to speak? Second call for members of the public. Any members of the public wishing to speak? Okay, final call, members of the public. *6 to unmute yourself or raise your hand within the Zoom meeting. And hearing none, we'll close out public participation. We'll entertain
Motion to adjourn.
Motion to adjourn from Duje. Is there a second?
Second from Kraft.
Second is by Kraft. All in favor of adjourning, please vote. Well, we do have a list of speakers on adjournment. No, that was something else. I'm sorry. All right, we are adjourned. Thank you all.
Nice job, Leon.
Thanks, guys.